Hi guys, my name is Tanya Diarman, and today I'm going to be discussing teenage pregnancy. I chose that topic for many reasons, honestly. It kind of affects me personally. Not that I was a teenage mother, but my mom actually gave birth to my sister and I both in our teenage years. She was 16 when she had my sister, and she was 18 when she had me. She was just graduating high school. My dad actually had to drop out of high school, to when my mom got pregnant with my sister to go get a job. I'll kind of be covering about like that here and towards the end. There's a lot of social issues with it. I wanted to compare it to like how it was many years ago, like say like 20-ish years ago to today. Fun fact, little spoiler, the numbers are definitely down from last like few decades ago. So let's just jump right in and get started. Introduction. Teenage pregnancy is pregnancy in females, of course, under 20. So about like 15 and 19 is typically the day when you see like how girls are getting pregnant, like around 15. 19 is obviously the cutoff because that's your last year of your teenage years. It's also known as adolescence pregnancy. So some risk factors associated with social issues, lower educational levels, higher poverty, and poor health care, to name just a few. There's quite a few, of course. So just to briefly cover one of those risk factors, lower educational levels. So like, meaning they're not taught a lot in school, like maybe in health class, about a protected sex, and like not taught exactly. Say, for example, like 15-year-old, like, yeah, they understand having a baby, but do they really understand what comes next? Like, you have that baby, more than likely, you'll have that baby the rest of its life. You have to pay for everything. You have to get up with it in the middle of the night. You have to probably take care of it. Like, it's definitely a lot. Spend so much money. And if it's just you, there's no dad in its life, that's definitely a lot. So that's definitely a big risk factor. The incidents, Save the Children, an article that I actually found and I did some research on. The article found that annually 13 million babies are born and their mom is under 20, so still a teenager. 13 million a year. That's just an estimate, of course, but that's definitely a lot. In 2018, a total of roughly, again, just a quick estimate, 200,000 babies were born to women between 15 and 19. So, yeah, that's definitely a lot too. And just a year, 200,000 to teenager moms. Okay, so causes, kind of like the risk factor, the lack of education on safe sex, unprotected sex. Kind of already covered that. A few examples of potential behavior patterns. So, early dating, lack of support, stress and depression, and sexual violence and financial issues. So, financial issues, I'll just cover that one. I actually found an article that I did a little bit of research on, and they said that this girl got pregnant because she didn't have any money. Her parents didn't care about her, didn't support her. They didn't really have good jobs, or I don't know if they had any jobs actually. But so she decided to go and get pregnant because she figured the dad of the baby would have to help out and pay for stuff for the baby, and she figured the dad would pay for stuff for her too. Well, it turns out the dad did not stay in the baby's life, or her life, of course. So she was alone to take care of that baby. Early dating, of course, like that has a big part to do in teenage pregnancy. Yeah, that's pretty self-explanatory. They're dating, stuff happens, a baby is to be expected. Diagnosis, this is kind of pretty self-explanatory as well. just like how one is told you're pregnant. Of course, there's some symptoms such as like morning sickness or like cravings, which kind of comes later on, I think in the second trimester, if I'm correct. And then just, again, throwing up, being sick if you smell something specific or like you eat something. You can take a pregnancy test, of course, if like you miss your period. You can go to the gynecologist and he will do, or the gynecologist, I'm sorry, will do a pelvic exam. And if the uterus is too big or the cervix is small, then that indicates that you're pregnant. So that's another way to tell. And then, of course, the common ultrasound. You can go, they can look on your stomach and obviously they'll see the baby, maybe hear the heartbeat. Also, you can like go to the ER, do a pregnancy test. They can take to the lab, kind of, or like a urine test, I'm sorry. They'll take it to the lab. So that's very similar to like the pregnancy test, but it's not at home, of course. So, next we're going to talk about some social effects, like how it kind of like affects the mom and like her life, social effects. Isolation, guilt, stress, depression. It lowers her self-esteem, no job, no support. So a little bit about like each of those. Isolation, if like she's on bed rest, for example, she's missing out on a lot. She's just not there, and yeah. Guilt, she's guilty, hopefully, well, not exactly hopefully, just like regretting it maybe. Not everyone does, but you never know. Stress, of course, like thinking about the future, like, wow, there's a baby, maybe babies in my stomach. What's next? What's going to happen? Depression, again, you're missing out on a lot. So, low self-esteem. Okay, so that's definitely like a big social effect, I would say. People tend to think different about you. Personally, my opinion is I don't really like see people nowadays like, okay, there's a teenager that's pregnant, say she's 16. It's not really looked at super different now because I feel like moms, or like females, I should say, are getting pregnant at a younger and younger age. So it's not exactly normal, but it's like not as abnormal as it was 20 years ago or years ago in general. No job. So of course, when you have a baby, you have to go on maternity leave. You're missing out on work. Or if like you're on bed rest during your pregnancy, you're missing out on work. You have to go for like ultrasounds and like go check on the baby and stuff. Missing out on work. Again. No support. So that also kind of ties in with how if dad decides to not stay in the life of you and the baby, your parents don't support it, or like your family in general, they don't support it and they're not willing to help you. I mean, it was your decision, so you don't have the support. That could be very hard. Okay, the impacts on mom. They have to grow up faster, just like there's a baby coming. Hopefully they decide to grow up faster, like they just become more responsible, hopefully. That's, I mean, of course, the goal that everyone wants them to see. But they just have to like really go get, hopefully, like a big girl job, hopefully finish school, and then just really be there for that baby. Like you have to maybe cancel plans, or you can't go out and party at nighttime all the time because you have a baby to take care of. Missing out. So again, kind of like maybe missing out on like a little party, or just like you can't go on your, maybe say a senior trip, for example, because you have a baby. You are just missing out on fun stuff that if you could potentially go to if you didn't have a kid. Your education, if like you're in high school when you have the baby, you're missing out, of course, because like you're going to be missing school potentially. I mean, unless you're like homeschooled, but you're still going to be missing some school and like maybe getting behind, especially like when you're giving birth and whatnot. Again, I kind of talked about that just previously. Your job. I'm not going to go over that again. I just talked about that. So the national campaign is to prevent teen and unplanned pregnancy was formed. So that's just like a group that formed to like help people prevent pregnancy and like inform people, educate people, females, on like safe sex. Every year since 2002, they celebrate in the first Wednesday in May. And just, again, that's like a super big day where like they educate people and they celebrate just like girls not being pregnant in a way, in like the nicest way, how to say it. So yeah, I just wanted to add too, I feel like I did speak about this in my discussion posts, but my personal opinion too, I feel like, as I mentioned, the numbers are a lot lower than they were previously, like years past. And I personally think that's because birth control is just pretty easy to get nowadays. Like, there's a website, like I don't know if it's called a website, like a group that called the Pill Club. You can just put in your information, your insurance card, a little about your like your health and like your medical history and whatnot. And they'll just send you birth control right in the mail. Sometimes you have a copay. It depends on your insurance, of course. So, I mean, personally, I think that's super easy. I work in a pharmacy. Birth control, you can literally call your doctor. Of course, you sometimes have to go to the doctor and get just a little exam done. But birth control is just super easy to get nowadays. And I mean, you can get condoms at a gas station in like the bathrooms. So yeah, that's about all I have. Okay, thank you.